The only thing is time is also a problem. Time because it's a and after it's not a session here. That means you have to be very tight on the answers and questions and company. I know it's difficult. If we cannot go to the whole question, it doesn't matter. I think to show the audience, you as a doctor, they as a patient, the benefiting of the technology and how you make that human. And it's not only technique; it's all the way you relate to them, the way you.
Interesting for the audience is I think, what they hear people using.
Yeah.
Who are involved in career. Usually it's presentation about people broadcasting messages and not
No, that's the message. That's the message.
So, as long as they can tell there's
Yeah, that's good.
doesn't matter what kind of questions are.
Exactly, and to show and to see the real world and how they take benefits from the. So far, so good. But I'm impressed by the Netherlands because I know the country because I'm working in the European scale. But I think you have been in the last 5 years. There's a lot of progress in Netherlands and about because you have a very complex system. Every country has a very healthcare different system. No? Go to France different, Germany different, Spain different, and you different. But you a very complex one. I think Germany too. I don't know where something is. The simple is Spain. Spain is very simple because it's a public service, and doctors and nurses are employees. All of them. Except Catalonia, we have a lot of private, but non-profit private. And the insurer, the public insurer, pays the hospitals, private hospitals, to the job. Thank you.
Latin area in Spain also is very good in regional.
Yeah, that is the size. The size is good because it's proximity to the citizens, to the doctors. They know. Sometimes it's not good too. Anyway, nothing is perfect. Nothing is perfect. I mean, to have doctors and nurses, employees is advantage because technology for them is okay because they have everything ready. They have to do anything else. Go there to learn and practicing. When you're private, you have to buy a computer, you have to buy software, but the disadvantage is you have the same salary, you work more than him. You say, why I'm working more, I have the same salary, you know? It's always this kind of tension. It's nothing perfect, no? But for technology, the Spanish model is working well for the size and for the technology. And I see, these days here, because I had the experience to see different activities in Amsterdam, in the Netherlands, and it's quite impressive the way you're moving forward.
Yes, and it's got an important logistic element.
Yeah.
And so this is very good in logistics. Logistics for projects are good luck.
Yeah.
Sometimes the weak point is decision taking.
Yeah. Ok. ¿Cómo te siento?
Health Project Manager.
Apúntamelo aquí si no me equivocaré. Rob, you start, no? Rob, same. Okay.
You want to know how to pronounce my name?
Rob, just good idea. Good word? No.
So you can do it. You're Spanish.
Yeah.
Housewife.
Housework.
But if you say good sword, I'm okay. So I
Housewife.
lived in the States and I
Housework.
stopped trying.
Okay.
But you can do it. If you're from Spain,
Housework.
they can do it.
Okay. Perfecto. Sorry. No, here we go. Here we go. I introduce you like this here, no change, no? Director in Health Innovation, Utrecht, Netherlands. You say Nauta? Nauta. Here we go, Nauta.
If you make a mistake, I will make a joke.
Okay.
Don't worry.
And the order is okay, no? You are the second. Or you want to be the third?
Maybe first.
The third.
Yes.
The third, okay.
Rob is first.
Okay.
So it's in
Okay.
sequence. Rob is okay,
Okay.
but we changed.
Okay.
Because otherwise I can't do
Yeah, it's better. Yeah. Okay. Let's sit here. See, let's sit here, Rob.
I'll take the. Take this one. I'll go here
Yes,
because I go first.
Yes.
Is that a good idea?
Okay.
Number 2.
Please. Oh, okay.
Yeah.
It's okay for me.
And then it's easier for Juan. So it's 1, 2, 3.
Okay. Good morning, everybody. Hi. Thank you for coming this morning. It's good to see you here early morning after last night drinking. It's fantastic. Good, good. You are very strong people, and you want to learn more things and share with you. Anyway, today we have an exciting session because we know in the world at this moment, or perhaps yesterday, there are 160,000 health apps in the markets, in the stores. 160,000. It's useful that? It's too much. What happens? Chaos. That's the real thing, chaos. But at the same time, more and more people want to have controlling the life, my health. I want to be me, my data, my illness, my health. I want to be in charge. I want to follow myself. It's a huge debate. And today, this meeting with an excellent panel, we want to try to explain to you how we see the next steps, what's going on. But not only the future in the coming days, weeks, or years, and to see how a doctor and patients are here with us. Thank you for coming. And to explain to us the experience they have using technology. Explain to us what is working, what is not working, what they expect and why they don't have, or what they don't know and is working, and how it makes their lives better. That's the aim of this session. That's why I think we try to be very tight on the time. We want to have this hour and have the voice of the patients, the voice of the doctor, to explain how it's working and how the future can be better and better with technology. Technology is only technology, tools, nothing else, tools. And the danger is when we put the tools before and after the patient, is the first the patient, the doctor, after the tools. And that means we are at this moment in a real transformation. It's not only gadgets, it's transforming the way we live, we work, we enjoy life, and we manage our illnesses or we manage our health. Anyway, let's go to the point. And we have 3 speakers today with us. By the way, I'm Joan Cornet. I'm from Barcelona. I'm director of mHealth area in Mobile World Capital, linked to Mobile Congress. Our job is to make things happen. We are a non-profit organization, but our job is in education, in health, and smart cities to do our best to change the world. Okay, let's start. But the first speaker is Rob Hauswart, more or less? Yeah, more or less, yes, okay. Is Senior Director Personnel Health Solutions at Philips, the Netherlands. Rob, the floor is yours.
Thank you. Thank you, Juan. So, if you come from Spain, then at least you can pronounce Goudsvaart, right? So I tried my luck. Well done, well done. Good morning. Did you all sleep well? You did? Did you have a healthy breakfast? Oh, very good. Were you active? Did you walk the dog this morning, or did you maybe walk from the train station to here? Very good, very good, very good. Seem to be trivial questions, but actually they're not. It's very important questions. And let me wake you up a little bit with some scary statistics here. We have a problem in Europe. We have 60 million diabetics in Europe, 60 million. And we have 1 out of 3 adults that are suffering from hypertension, right? Wilco is the hypertension specialist from UMCU, and he confirmed it. He also said it's the most important reason for mortality, right, in Europe. 1 out of 5 is obese. And if you add the overweights, it's half of us, right? Scary numbers. So something needs to happen, and we need to change. And if I say we, it means I need to change. It also means you need to change. At Philips, we want to help that change, and our philosophy is to do that to move care closer to you. So what you see here on this slide is literally going from before you're born, with a mobile ultrasound, to old age, where we triage in a call center, for instance, when people fall, and then we send help. So before cradle to very old age, we're moving care closer to the patient and to the person. Second part of how we look at things is that health is a circle. It's about a continuum. It goes all the way from healthy living, prevention, diagnosis, treatment, to home care, and back, right? So if you know that 70% of healthcare spend currently is in diagnosis and treatment, it also shows that that emphasis is wrong and it's not sustainable. So we need to move our efforts across this continuum. And we also need to move our efforts, therefore, to prevention. And that is why we have a host of prevention and wellness programs that are really where consumer and healthcare collide. And this is, by the way, also the history of Philips, right? 125 years of consumer insights gathering, and also a big healthcare player. And this is where it comes together. So this is programs for people that want to feel better, that want to feel healthier, but also for people that are at risk and want to prevent chronic disease, or want to, if you fall ill, slow down the progression of it. So the way we do that is not only with technology. We see technology as an important enabler, of course, and the digital age gives us a lot of opportunity there. But we feel that only by combining it with psychology, we can make an effort for behavior change. And how that works, for instance, is if you had a chance to walk around, you could see our Health Watch, which is a watch that is designed as a medical device, a very accurate heart rate tracker, and much more. That, for instance, gives you insights through an app on how many minutes a day are you really active enough, and how active are you, and compare that with the minutes that you're sitting. And I tell you, that's scary if you see that. That's a scary insight, and those type of insights gives you the urgency to do something, the urgency to change. So the second element is to make it very personal. It is your data. You generate that data. So I can actually show you how much I walked this morning and how much I slept. And because it's my data, it becomes relevant for me. And that in combination with the medical expertise that we have combined in this system gives you the confidence that what you do for your health is the right thing. Another example. This morning I read in the paper that the Dutch consumer organization Consumentenbond, they did a test with these shakes that you can drink to lose weight very fast. And do you see it? Actually, they contain an enormous amount of sugar. And one of the most sold shakes contains more sugar than Coca-Cola, right? So we don't believe in that. We believe that real data give you real insight, and we don't believe that you have to change radically. We believe in small steps. So small steps will make a big difference. And for instance, if you're obese, right, body mass index over 30, and you lose 5% of your body weight, it doesn't seem an awful lot, and you probably would do good to lose even more. But it is already a big step for your health. It's already that small change that changes your metabolism and your metabolic health. And these are the small steps that we want to aim for. So how do we do that in practice? One example is what we do in Germany currently. In Germany, we work together with Allianz, another global player, and we bring innovative personal health solutions. So in this case, we have a back pain solution that works with a blue light patch that you wear, and an app and a coaching module to help people with back pain. We also have a health module that is aimed at people that want to feel healthier, but also at-risk people that get a more intense program. And we go to employers that care for their employees with such programs. And we have that running now most of this year. And actually, the employers see real value in that behavior change. They see real value in days that people are absent, that are reduced, and real value in productivity that goes up. So happy employers, happy employees, and real value. And that's what it's all about, right? Thank you.
Rob, it's so good. The time is exactly perfect. My control was perfect. Okay. Anyway, Rob, one important thing today is, and he was very right on that, behavior is health. The way we behave, and technology helps us to be capable to track ourselves. That was excellent. And I think it's excellent because it's a drive to change the way people see the health and people manage themselves. And now it's time to see another part of that. Another company is working hard on that, and it's Tomás García, who will speak, is mHealth and Wellbeing. Wow. Listen, health and well-being together. That means it's together in the title. Product manager at Atos Worldline. Thomas, the floor is yours.
Okay. Good morning. Hello. Hi, hi. Yes? Okay. Okay, good morning, everyone. And first of all, thank you for inviting me here, having the opportunity to share with you our experiences with the mHealth domain from Atos Group, and particularly my unit division. You can hear me? Okay. Hi. Hello, hello. Yeah, better? Okay, so I was saying that from Atos Group and Worldline, particularly my business unit, we've been for some time working in the e-health domain, in the e-field. And today I would like to introduce to you to our connected assistance solution. This is an initiative that we pushed internally, and we are now almost going to market. And the aim of our platform is to empower patients in self-managing their health data, and at the same time to connect these patients with a caregiver network, caregivers that can be professional caregivers, but it could also be the family or the community supports, in a way that they stay connected, in a way that they share and they can be monitored so they can be helped. In the end, we are focusing on people with chronic diseases. We are focusing also on people in a post or in a pre-surgery pathway. We are focusing also in older adults living alone at their homes that are willing to have an independent life, that they also require some kind of monitoring. And ultimately, we are also facing or addressing the solution to people alleged to be worried about their health condition and willing to take control on their health data in a single place. Joanna pointed out that so many applications that are now in the market. We would like to have all this data into a single place and use products like this one or other health devices integrated into a single point of access, but not only this kind of medical devices, also sensors that we have in our watches, sensors that we have in our smartphones, fitness and well-being applications in the market, like the Apple one, the Google's, Samsung's, etc. So we would like to integrate all this data for the health and well-being into a single place in order to share it and be monitored, and also to control ourselves. From the beginning, we faced that it was going to be a challenge to design an application like this. So we asked the users, we co-created with the users, in order to see where were the insights, what were the insights in that. And we found that specifically, sorry, we found, to summarize, three big drivers. One was motivators, so how we could engage people to use this on a daily basis, or how engage people using the applications. So motivators, they could be, for example, how to anticipate problems for users. So they found that interesting. Also, how to create in them a sensation, for example, of pleasure when they are committing or completing some challenges or some tasks. And in the end, the social aspect was also very important. How to create a feeling of belonging, the social acceptance versus the social rejection. Simplicity factors, they were also very important in the design. How to create a change in behavior that easy to do. So simplicity factors could be money, could be effort, physical effort. It could be time. So these kind of things that in the usability domain make a difference with the use of applications. And finally, triggers. If you don't have triggers, you are not going to have a change in behavior. Triggers could be notifications, alerts, calls for actions. They could be also signals for users. So that is, we created a network in which we could connect any type of device having an open API. And at the other side, we could have this care network trying to help these users. So I'm going to present more in a graphical way, in a journey, in a particular journey of Ulises, who is a 70-year-old man with a recently heart attack, how he's going to live with the connected assistance, how connected assistance is going to help him. On the first place, we're going to provide him a daily agenda, so he can have either in the smartwatch or in his smartphone the appointments that he have on a medical basis, or even a wake-up call, and these kind of things that are going to facilitate his independent living on a daily basis. But also, it's very important to manage the medication that the person. So, as someone said, it's not only about devices and technologies. We would like to provide a holistic view of the assistance. And according to some of surveys, 50% of people is not taking the medication prescribed properly. So we need to help them and to get feedback of if they have taken the medication or not. Motivational activities are also very important. We are introducing gamification in order to introduce challenges and rewards to these people. This also is creating motivators, as we saw before, that are going to support the behavioral change, but also provide health education about their condition, about their health that is also accompanying them in the emotional journey, which is also very important. Nutritional information is also added to the assistance, so on a daily basis they can have information about what they have to eat made by the nutritionist, so they can build shopping lists when they go to the supermarket. Obviously, the core aim of the platform is to monitor their health conditions. So again, we are using health devices. We're using well-being and fitness applications in the market. We are using also ambient and home sensors as to also monitor the contextual information about this patient and provide analytics and dashboard for that. And we want also to stay in constant communication with those users in case there is a problem, an event in their health condition. So, for example, from the watch they can push an alert, an SOS message to the caregivers. Finally, the caregivers are going to remote remotely assist this person in real time, so going to receive alerts on the health conditions. We can set when something is getting wrong, and act accordingly. So all the caregiver network starts to attend the user demand. And finally, as I said, this social aspect is going to be very important. We are also introducing a chat communication, which directly provides a communication channel between this caregiving network and our patient. And thank you very much for. I will hear around, so I have some demos. So anyone interested, I will be more than glad to show you what we have been doing in the last time. Thank you very much.
Thank you. Thank you very much. We have been two examples, two companies, very advanced, pioneering the change in healthcare, in mobile technology, behavior, and company. That's fantastic. They're moving faster and moving with the security, things good for the patients and doctors. Now it's high time to talk about Netherlands. I have to say, I have been working before the capital. I was working in TIC Salute. There are people TIC Salute here, my colleagues with the past. And I follow Europe for 7 years about changes. I'm really impressed being here these days to see how much Netherlands, not me, Netherlands has improved, really. Congratulations. I think the way you're working, I know it's a complex system because healthcare system is different in every country. This one is complex, but anyway, you're doing very well. I'm feeling happy to see how progress is made in your country. But now it's time for Hilco Nauta. It's okay? He's the director e-health innovation UMC Utrecht in the Netherlands. The floor is yours. And he, at the same time, will introduce the doctor and the patients. Thank you for being here. Thank you. And the floor is yours.
Thank you very much. Is the micro working? Yeah, thank you very much. Yes, my name is Hilco Nauta. I'm with the academic hospital UMC Utrecht for 9 years, and my current passion is e-health innovation. And I would like to share some experiences we have last half year with e-health. And I can tell that, but I think a much better person to share the experience is somebody else. And we found Lotte. And Lotte is a 16-year-old girl with juvenile arthritis. And she can explain how she thinks about e-health together with her professor. And then after the video, I will catch up with some thoughts about our thoughts about e-health innovation, and then we'll hand over the mic to a panel discussion with two patients and a doctor who are the real users of what we've been creating now up so far. So first a 3-minute video performed by Lotte and Nico, who's her doctor.
Hey, hallo, welkom.
Oké, tot zo, hoi.
Ik ben Lotte, ik heb jeugdreuma, ik ben patiënt van dokter Wilfraat.
Ik ben kinderarts, reumatoloog en hoofd van de afdeling kinderreumatologie van het UMCU.
Patiënten en dokters werken momenteel samen aan het ontwikkelen van een app.
En die heet Reuma2Go. Ik gebruik mijn smartphone eigenlijk vooral voor mijn werk.
Ik ben heel erg verslaafd aan mijn smartphone en ik kan eigenlijk niet zonder.
Dat we op een hoger niveau nog kunnen gaan samenwerken met patiënten.
Ik denk dat ik de Reuma2Go-app niet elke dag voor de lol ga gebruiken, zoals ik bijvoorbeeld Instagram check. Maar dat het meer gewoon iets voor mezelf is, wat ik dan 1 keer in de zoveel dagen ga doen om even goed gewoon een overzicht te hebben hoe het met me gaat.
Hey Lotte, hi.
Hallo.
Zo, goed je weer eens te zien. Kom zitten. Als patiënten en dokters of zorgverleners steeds meer gaan samenwerken, dan zie je dat patiënten steeds meer over zichzelf gaan vertellen en ook meer hun eigen visie en zicht op hun ziekte. En daardoor leer je veel andere dingen van patiënten als dat je dat in de spreekkamer leert.
Het lastige aan samenwerken met je dokter is dat je het ene moment zit je met hem in de spreekkamer en zie je hem echt als je dokter. En het andere moment zit je in een vergaderruimte en noemt iedereen hem Nico. En zit iedereen grapjes met hem te maken.
Dat heb ik helemaal niet gezien.
Gezondheid op het internet?
E-health is eigenlijk het totale gebruik van diverse digitale computermiddelen in de gezondheidszorg in een ziekenhuis. Dat het een diep gevoelde wens is van ziekenhuismedewerkers om beter met hun klanten, om het zo maar de patiënt in contact te komen. Waarbij we beter zicht krijgen op wat hen drijft en wat hen dwars zit.
Iets van e-health wat ik heel veel gebruik is het patiëntenportaal. En daar kan ik mijn uitslagen zien en zien wat dokters over mij hebben geschreven. En zo was het bijvoorbeeld heel leuk als ik gewoon in Italië op vakantie ben, kan ik 's avonds op de bank heel even snel mijn bloeduitslagen checken. Dat het vroeger helemaal niet kon. Mijn hoop voor de toekomst is dat je veel minder energie kwijt bent aan dingen regelen, zoals afspraken maken, naar de apotheek gaan, van tevoren moeten bellen voor de apotheek en allemaal dat soort gedoe.
Dat we samen kijken of we er tevreden over zijn. Want uiteindelijk moet die app door de patiënten, door alle patiënten gebruikt gaan worden en voldoen dus aan de wensen van de patiënt.
Ik denk dat e-health niet de hele gezondheidszorg gaat veranderen, maar ik denk dat het wel een heel belangrijk hulpmiddel wordt. Maar toch denk ik dat het contact tussen de patiënt en de dokter, als je hem gewoon spreekt, dat dat het belangrijkst blijft.
Well, you understand we are very happy with Lotte because she has helped us a lot in creating apps and think about the patient process. And we have learned a lot from our patients. And we've learned a lot also from the general practitioners who are working with the patients together with our physicians. And what you see in this video is Lotte is in fact a symbol for e-health. The new generation is coming. And what you see is that the old world meets the new world. A 16-year-old girl meets a professor. And she has a kind of conflict because she wants to see him as the doctor, an authority, and she's very polite. There's a certain distance. But she also works with him as Nico, together in a project, and did together create apps. And that's a totally different relationship she has with her doctor. And that's one of the messages of e-health, is that it affects the relationship of the doctor with the patient, vice versa. What you also see, the old world meets a new world, it's different technologies. The apps are connecting together with the old-fashioned EMRs, the electronic medical records. And Lotte thinks it's a no-brainer. I'm using my app like I'm using Instagram. And the doctor is still working with his medical records. So what we've learned is how we can integrate them together. What you also see is that the world of the apps and Instagram and Facebook is very informal. No privacy, no security. Well, we face in our EMR strict regulations by the government about privacy and security. So we learned how we should combine those two worlds. What you also see is that the way we work in the old way is it's an odd kind of doctor-centric process. We organize everything around the doctor. And the new way, we try to organize everything around the patient. We call that a continuum of care, that everything runs smoothly in favor of the patient. Now, our hospital, what is our strategy? Our e-health strategy directs patients connecting to doctors. And we direct our efforts, patients not only connecting to doctors, but also to nurses and to doctors outside our hospital with whom we work closely. And we have created our patient portal, and patients, as Lotte said, have direct access to their medical record and the full range. They can see everything without any hospital delay caused by procedures. So they can see their lab results, they can see all the internal notes, all the recommendations, they can see all the incoming letters and outgoing letters. So it might be possible that they see the lab results much earlier than the doctor sees them. And we've been thinking about what could be a useful next step. And we think a next step is that's not patients accessing only their medical record, but we would like to facilitate them also in their self-management, if they want us to do so. And that's clearly a next step outside our own compound into the home or the vacation address of the patient. And we've been thinking about the process, which is our current cure process is kind of reactive. We would like to be more just in time, provide care when it's needed and indicated by the patient. And that's where the apps allow us to do so. And we've been thinking about how we can extend our cure process with also caring about the patient at home. Well, we are very happy that we have a panel, and we've invited 2 patients and a physician to share with you their experiences. The patients are Jan, who is facing ALS disease, and we have Marlies facing juvenile arthritis, and she's one of the artists of the movie also. And we have, please come on stage. And we've got Wilco Spiering, Dr. Wilco Spiering, who's a specialist in hypertension, hypertension for complex patients. And they all 4 have been participating in the pilots we have started. And they, under the guidance of Joanne, we can have a chat. And probably you have got some questions, but probably also the floor is yours to ask some questions. And Joanne, please go ahead.
I think one question on your situation and your long time probably. What is your experience as a patient? What is your, what happens? What is your way to deal with your illness? How your life change? What is your limits or not?
Does it work?
Yes.
Okay. Well, when you get diagnosed with ALS, or motor neuron disease in English, I guess, your life totally changes, of course. ALS is a disease in which you don't go often to the hospital, because after the diagnosis, your future is clear, there's nothing to do about it, and there is no actual cure. So you don't go to the doctor that much, but very often to other caregivers. And then you experience that, like here, this all modern technology and e-health, but in real life patient world, especially outside an academic hospital, you are still on written notes in the map without any communication or a small form of communication between different divisions of these caregivers. And that if you don't look out good, that's not a good sentence, but if you know what I mean.
Yeah.
Then your life gets totally ruled by all kind of appointments with all kind of different caregivers, which has no combination or no samenhang. Sorry? Coherence between them, yes. That's what you experience.
Thank you, Jan. I think it's very, very explanatory. You.
Does it work? Yeah.
Yes, please.
Well, I have arthritis since I was 12, so I have arthritis most of my life. Well, when I'm feeling good, then I don't want the arthritis to be of much influence in my life, but it is there every day, also on the good days, because it influences what kind of shoes I buy, it influences what kind of milk carton I use in my house, so it influences everything. And also what Jan says about the caregivers, it's also a lot of fuss. I have to go to the hospital regularly, in one way or the other, it's never possible to to make combinations of different appointments. So I can go to the eye doctor on the same day I get my medicine. So it's also always a big fuss. And then next to the hospital appointments, you have the insurance companies you have to deal with. So yeah, I think daily life with a chronic disease is mostly about the fuss around the disease.
That means when you have something online or applications, you think it's helping? Is helping you to live better, or what do you think?
Yeah, I think what would help me is if I will be able, because, for example, by using an app, to have direct contact with my doctor, to make my own appointments, so that I can say, okay, that day I have to go to the physiotherapy, so I want to make a combination with seeing my doctor. That would give me a lot of freedom. But I'm not really sure if that is going to work, actually, because the hospital is a very big organization and they all have different agendas. And so, yeah, I want that, but it's not always possible.
Okay, and you, Jan, do you think it helps to organize yourself?
Yes, I saw earlier in the presentation managing your own data would be great, because my data is scattered all over, and my data is everywhere. In Utrecht, it's quite good. They have a very nice system, but that's not normal, not everywhere. If I can manage my own data, I would say if you can manage your own appointments, that would be great. And if you have a good communication with your doctor, example for easy tests, you don't have to go to the hospital or to the caregivers all the time. It's like easy things like weight, which is important for MND, or your lung capacity, or all these tests which are quite simple, you can easily do at home. And if you can upload them to your own file, and you can see it, and the other caregivers can see it too, you have a different contact with your doctors. You are like in the center of control, and not more like not the old-fashioned patient anymore. And you feel more in control of your disease and more in control of your life. And in maybe the future, if you can expand that with insurance companies or all these other parties, or your medical devices, because I'm not moving very well anymore, and that is decreasing all the time. You need all the time new equipment, and if you have the information and the way how to get these things on an easy electronic way, that would improve your life much. And for my colleague patients, some people are older or not so, they don't have real good capacity to organize things themselves. They would have quicker and better support.
Jan, thank you. The doctor, Wilco? The name is
Wilco.
Wilco,
yes,
sorry. What do you think? What is your experience, patients with technology, not technology? What is the difference? Do you see anything?
Well, we in UMC Utrecht, the mic, please. Yeah, we in UMC Utrecht work with our patient portal since 1 year now. And a lot of my patients at my outpatient clinic can follow my notes, see their lab results, etc. And that's very important. And they sometimes, just by sending an email to me, alert me to specific results that I didn't see yet, or a specific letter from another physician. And they will, they keep me where I should focus in those patients. One problem in my case is measuring blood pressure. We know that measuring blood pressure at the hospital is the most worst case to measure blood pressure. You should measure blood pressure at home. And that is a big problem and big fuss for me already for 5 years. Measuring blood pressure at home is not a problem, but I want to do that in a standardized way with validated devices. And I want the data integrated in my EMR. And that is something we are now working on. And that's really will bring us a big step further to have integration of all the data of the patients, not only their complaints, but also the data of blood pressure and weight, etc. And that is something that is really important for the next step in my case of these kind of patients.
And in your hospital, you have support from the hospital to do this way.
Yes, we are now in a project that we really trying to focus on integration in the EMR, and that is something that I really would like to stress that is very important, because I don't want a web browser or an external system. I want the data integrated in the EMR so that also the patient sees the data that of course are the data of the patients themselves, integrated with all the other results, lab, etc.
Excellent. Martin? Marlies, sorry. Do you use wearables apart from the illness itself, but you use something about your health?
Well, since a while I use to count my steps every day.
Yeah?
It's very confronting. Yeah, so that's the only thing I use.
No, I think that is good, because the first time I had these kind of things, I myself believe I was a good walker.
Yeah.
I realized I'm not. I'm moving a lot, yes, I'm moving, but I'm not walking. And it was not 10,000 steps, only 5,000. I was panicking. Anyway, it's good health to do something exercise.
I bike a lot, but he doesn't count it the right way. So I do move, but...
That's good. And Jan, you have some kind of wearables, some kind of...
Yes, but I'm still working on it.
Yeah.
But I'm in a pilot project with the UMC Utrecht, and they made an app, and that's for measuring weight, and there's some kind of validized questionnaire which all the MD patients use. And you can fill it out and you can see your own progression in the disease. And that's very helpful, because you think you know your state.
Yeah.
But if you fill out all these questions, you get a real good picture of the timeline and how you're doing. And that's really, really good to see.
That experience, Jan. You as a doctor, because you are trained to prescribe and to diagnose with evidence. How do you think the wearables are evident or not evident? How you have knowledge? Where you try to inform, to have information from that?
That's a very important issue that you raised there. For me, it's very important that I get very qualified data, so validated data. I don't want blood pressure data of a very consumer device that is not validated, because I have to make changes in the policy. I want to change medication based on those results. So I want those data to be very valid, and that they are very qualified, and that are, in the case of hypertension, that they are measured in a standardized way. So we have to create that, so that the patients measure those blood pressure data in a very standardized way with standardized devices, so that is very qualified data, because the changes in medication for those patients can be very important. So quality of data is very important.
That's the key word, quality. Not only data, quality, and it's not easy sometimes.
Quality and integration. That's
yeah,
the two key issues.
Two key words. Back to you again. In the film, the video, and before was about the Instagram and other things, no? Probably you, like me and you probably, it's difficult to imagine something is not yet there, no? Everything is there, in the mobile, in the Facebook, in the Instagram, and more and more. From the healthcare side, what do you think would be useful for you? That means your dream, no? I want to have, what is...
Yeah, I'm in the group of people who work on the Reuma2Go app. So yeah, we have a lot of discussion about that. What does the patient want? What does the doctor want? In the end, we want the same thing. We want a better life with a chronic disease like arthritis. But we need different things at this moment. What I would need is, to make it to make the fuss go away. So what make my life would direct contact with my doctor on the moments I want to. What make my life would be easier if I could combine appointments. So an agenda would be helpful in the app. That's already in there. But for the doctors, they want to know how I'm doing. And for me, that's important to know as well. But when I get out of bed, I already know how I feel. One day I'm very good and I jump out and go do my thing. And the other day, it takes a long time. So for me, it's not necessary to fill that out in an app. The doctors want to know when I get out of bed easy and when I don't, because that gives them data and they can use that in research. So we want different things. So I think we should make a combination of both things. I'm willing to give something if I get something back in return.
Good,
Yeah.
excellent. Jan, the same. Do you think something you imagine can help you
Yes.
are not yet there in the market, or not yet not discovered, or not available?
Well, that's good to say that because our patients feel the same way. We had a brainstorm session with all our dreams, which we would like to have in this app or in your electronic device. And that's, for the patients, the most important thing is self-control or self-management. Appointments, see when you have to do something, or when you have not to do, go somewhere, that's very important too. I think that's a real drive of a patient to use such a thing. Besides that, so like your medical data or giving in how you're doing, it's true. You think you know how you're feeling, but if you see it and you can upload it, it gives you a clear picture, and it's not always the same as you think you feel. And your direct contact with your physician or your doctor, and uploading to your own file and sharing your data with all the caregivers around you, that will be my dream. And then I am in the center, and I'm in control, and you feel more in control of your own life, especially with a disease like I have. Because practical life is getting more difficult all the time.
Yeah.
And like a simple thing like going to the hospital or coming here at 9 o'clock is quite a journey, this adventure of arranging all kind of things. And if you don't have to do that too much, then your life improves.
Good, thank you.
I think that's a very important issue that you raised, because increasing self-management is increasing the control of your disease. And for me, as hypertension, we know from scientific research that the patient is more in charge of his disease by self-management, then there is a better control of hypertension. And then the number that were raised by Rob is decreasing, because more patients get better control of hypertension by increasing their self-management. And I think this is a way to do that.
But I believe in the small steps too.
Yeah. Okay.
I think if you go too fast, you lose too many people. Because like a 16-year-old girl who is used to working on Instagram and on her iPhone all day, maybe she will do the things she has to do. But like older people or some in between like me, like 40, not everyone is used to working that much with those devices. And I think if you do too much at one time, you risk, or the risk of losing patients is big. So I believe start easy, start with something which is helpful to the patient.
Yeah.
So like organizing your appointments, and then expand it to like now. Like
And I'd like to add that I myself find that as a person, I'm like pro-change and I want different things all the time. But as a patient, I'm a bit more conservative, because then what I know is safe and what is new is a bit scary.
Yeah.
So I think you have to bear that in mind, that for patients, it is a new thing that is scary, that may influence their health. So I agree with the small steps. Ambition is very good, but yeah, we have to be on board. The patients have to be on board, and we shouldn't be scared.
That's great.
Yeah. And the UMC Utrecht, for example, is not like the rest of the country. Because I don't know how it in another country is, but like our local caregivers, the administration is totally old-fashioned and totally not ready for a very big difference. So you have to take them in small steps too.
That's being a question. The last question for you, doctor. You are somebody jumping in, practicing, having your patients and using technology. What will happen if half of doctors are not keen on technology and half they are keen on technology? What is the scenario? What do you think as a professional?
Well, that's a very good question. What I experienced was we are working with an external system on a web browser, and my other colleagues stopped using it because it was too fuzzy, going from screens and typing over all the data. So I think, and that's what I had the discussion with my colleagues, is when there is integration of the data in the EMR, so that's very easy for him because they see the data in the EMR, that will help my colleagues to use this system as well. And I agree with the patients that we should be careful by taking too big steps, yeah, because we need to have all the patients on board.
Excellent. You don't mind, perhaps, your floor is yours now. Rob, come here too, and Hilico and Thomas with us. And please, any question, either to the panelist or the patient and doctor. Somebody has a microphone? No. Yeah, sorry.
Okay, thank you very much. My name is Bart Brandenburg. I'm a general practitioner and now working in e-health. And I have a question. I was very fascinated by the discussion and the viewpoint of the patient. And I was wondering, in reaching your goals, having a better life with a chronic disease, making the fuss go away, what role is in the technology and what role is in the organization of healthcare? Because I think I've heard you say it, that the organization is a big hurdle also. So I'd like to hear your point of view on that, please.
Yeah, I think the technology is there, but we, the patients, are conservative, I think. Organizations all over the world, we are used to one kind of healthcare, and that has to change. So I think the technology is there already, but we together have to get used to it, and I think that will take some time, maybe a lot of time. Yeah.
Okay. And maybe for everybody who feels wants to comment on this, is what can we do to get the organizational change or the social innovation, if you want? How can we change the way we work in healthcare? Because, like you say, the technology is there. Yeah. So, anyone?
Yes, Hilico, you have an answer.
Well, basically, I'm not a healthcare provider, but that certainly has been on the agenda because one of the I have two faults. One of them is that the patients, in a very early stage, indicated that they always wanted to have a good access to the doctor, face-to-face or by phone, direct, 24 hours a day. So whatever we do with technology, they want to have direct access to the doctor if needed. But that's what we have to change.
You have a question? Do you think we have to change that we as patients see our doctors? Or
No, we as
a hospital.
We as a hospital. We as a hospital. Because sometimes you cannot reach us.
Yeah. Okay.
So whatever we do with apps and changing the patient process, we should organize ourselves such that a doctor or somebody else, a nurse or somebody who replaces doctor, is ready to answer the questions of the patient. Huh? And that was on the top list. The other thing is it's so difficult to make appointments because we're realizing this with general practitioners from huisartsen Stad Utrecht, local practice in Utrecht, the general practitioners, but also with the revalidation doctors from the Hoogstraat in Utrecht. And the patients, one word comes into my mind. That's the circus of appointments. As soon as they're diagnosed, they enter a field, a circus, an arena, and they have to coordinate everything themselves. And they have to make appointments with 5, 6 different parties. And they experience that as being a circus. And they have to orchestrate circus. Well, that's something all the people involved in the continuum of care surrounding the patients should organize themselves better. So there's a clear invitation for better cooperation by GPs, revalidation, hospital doctors, so we can facilitate the patients much better in all the appointments.
Okay, no more questions. I have a question myself for Rob and Thomas. We've seen today here the doctor and the patient's experience. How do you, as a companies, when you produce a new, as you said, explained today, your new services, how you check with patients and doctors what you're doing? Rob and Thomas, please.
So for us, that starts in a very early stage. Almost everything we do, especially in our healthcare domain, is with doctors and patients. So we're kind of in the middle of that. So when for us, it starts in research. And in research, actually, the core of what we bring as a product or a service later on is developed by a doctor. There's many medical doctors involved. Fortunately, we have the opportunity to test things, even in the clinical settings, very early in almost every hospital in the world. And so for us, it's at the core of what we're doing. So this medical expertise is how it was born. With patients, I think a big challenge for us is to bring, as a neutral party that works with all of them, to bring the two together. And that's the big challenge, because yes, sometimes it is different worlds. The world of doctors and the world of consumers, let's not call them patients yet, is not always one. And we see ourselves as Philips being part of the consumer world and part of the medical world as a kind of integrator of the two.
Great. Thomas.
Yes, I totally agree. From our perspective, it's also a service design methodology that we follow. So we involve from the very beginning different stakeholders, doctors, patients, in workshops, firstly in a research phase in order to understand their needs, to understand or to capture the insights in the use of devices, or in the engagement or in the motivation of the different stakeholders, either patients and also doctors. And then we have also internal departments that are specialists in the health. So they are doctors, and they act also as advisors for the particular pathway that we follow in our designs.
That's important to know, because for people who don't know what exactly happened, the companies, we think it's like a TV, a plasma TV, no? Somebody makes a plasma TV and they go to the market. It's more complex. I think that's important to know. Companies in this moment are very close to doctors and to the patients to be capable to design accordingly with you. That's important. Time is flying, but I want to know if somebody, the panelist or you, want to ask questions or to say something. Please, the floor is yours. Any question, any comment? Sorry. Micro? No micro?
Thank you. Hi, my name is Lianne. I work for the Royal Physio. It's a company for visually impaired blind people. I have a question for you, because you told the patient can send you emails or alerts. How are you going to manage all the emails and all the data and stuff?
Well, it's a very good question. That's something we had to change, because we didn't know how many emails there were coming. So what we changed is that we have one nurse that's managing all the emails coming in, and she divides it to the different practitioners. And we say to the patients that at maximum 3 working days they get a reply back, so that patients don't expect that on the same day they get their reply on that email.
Okay.
But we do a triage of all the emails that are coming.
Yeah, I think it's going to be hard with more patients later on. Did you think about that as well?
Yeah,
but
it was something that the hospital decided, and we had to work. So the board said we're going to do this, and we had to adapt to that, and that's something I think that is needed sometimes to take important steps.
Yeah.
And we changed our whole small organization to control for those emails. It's working.
Yeah, thank you.
Thank you. Another question? You want to ask a question? Somebody was... Jan.
I would like to... Still working?
Yes, working.
I would like to add one thing. The side effect about building these apps is that, like the pilot with the UMCU, is that people are not talking about patients anymore, but with patients, and from the start. I think that's something new too, because I go to a conference like this a lot of times, and I hear the word patient maybe 500 times, and the patients can speak 1 minute at the end of the day, or not at all. And now you see, and that is a very important side effect, I guess, that people, and that's, I have the feeling that it's getting more normal, that the patients are involved in all of these kinds of things from the start on. That's what I really like about it.
That's perfect. It's the last message is the closing message for this. No? We have to take into account the patients, not only naming them, we have to have them involved in the process and the implementation and the following up, that if not, it's not working, it's only gadgets. Okay, time is time. I'm very sorry. We can talk for all morning. Probably amazing things, you and us. Thank you very much. Thank you, doctor, the two patients, Jan, Maris. Yes, I'm a Spaniard. It's difficult to say that. I can make a special course. Thank you, Rob. Thank you, Thomas. Thank you, Hilico. Thank you for staying here, so many people. And the future is that, working together for the benefit of the patients, citizens, and consumers. Thank you.